Welcome to the Aseptic Dispensing Unit, or ADU, at Calderdale Royal Hospital. The unit was commissioned in the early 2000s and represents the standards that were required of an unlicensed aseptic unit at that time. Some of the features are outdated and would not be used if the unit was commissioned at this time. As we look at the aseptic unit, you will see some features and equipment appropriate to an aseptic unit operating under Section 10 exemption from the Medicines Act 1963.
The first room we see is the change room. This is where operators change from outdoor clothing into cleanroom specific clothing, a non-shedding coat, and they will cover exposed skin and hair with a cleanroom cap and gloves. Those with beards would also need to wear a beard net to ensure that loose hair and skin flora cannot contaminate any products or equipment within the unit. No jewellery is worn within the ADU as it is difficult to clean effectively and can damage the equipment if it is worn. The step-over bench divides the room into a clean side and a dirty side. This is another feature that helps the unit maintain its clean zones by providing a physical barrier that ensures people cannot enter the unit accidentally or in outside clothing. This is a minimum required standard in the Yellow Guide. In other units you may also see sticky mats which take particles off cleanroom footwear prior to entry. The cleanroom is technically a Grade D room under EU GMP classification. The door into and out of the unit operates on a magnetic interlock system which ensures that both doors cannot open at the same time and gives an element of control over who can enter the unit. It also ensures that the room can be flushed with clean air each time a door is opened. Again, this is a required standard. This is where pre-manufacturing preparation and most of the disinfection process occurs. Here you can see some more required features such as there being no acute angles within the walls and floors. These are constructed with vinyl facings. This allows easy disinfection and ensures that there are no dead spaces where dirty air and dust can accumulate. The light fittings are sealed to ensure that pressure cannot leak out of them and contamination cannot enter the suite here either. There are work surfaces which are smooth and easily cleaned and sealed. Cabinets are wheeled to allow for easy moving and cleaning. Here you can see grills in the wall which are part of the air circulation system and help to maintain clean airflow throughout the unit. Air entering the unit at this point is filtered via the high emission particulate air or HEPA filter to Grade B standards. This is a higher standard that is currently required for this room under EU GMP regulations. The manometer bank is a very important part of the ADU as it is this that shows whether the downward positive pressure gradient is in operation throughout the unit. Within the 3 clean rooms where aseptic manipulation takes place, there is a requirement that air pressure in these rooms is at least 10 pascals higher than the support room, which is in turn should be 10 pascals higher or more than the change room, which should be a minimum 15 pascals higher than the unclassified outer corridor. There are 3 clean rooms at CRH. Each receives filtered air via the HEPA filters within the room and will attain Grade B standard with no operators present. Having an operator in the room will take this standard down to Grade D as operators are the largest source of contamination in any aseptic unit. This could be remedied by a stricter clothing policy as can be seen in this picture, but it is not required in this ADU as all manipulations are completed within isolators. Isolators require a Grade D minimum standard. In a different clean room, we have 2 negative pressure isolators. These operate at a lower pressure than the rooms they are in, which causes an intake of comparatively dirty air if the cabinet is compromised. This is a safety aspect and results in contamination being pulled away from the operator, maintaining their safety. This type of cabinet is used to manipulate dangerous products such as those that are cytotoxic, mutagenic or teratogenic, where continued exposure would potentially cause unwarranted side effects such as cancer, fetal termination, mutation of unborn children and others. This is a 4-glove positive pressure isolator. Positive pressure means that the pressure within the cabinet is higher than that in the room. This ensures that if the cabinet is compromised, the product being made is kept in a sterile field. Unfortunately, this also means that any airborne contaminant is pushed out in the direction of the operator. For that reason, no dangerous products are made in the positive pressure isolator. It is an outdated isolator as standards require that we no longer work side by side while making products. This helps to ensure that there is no cross-contamination risk to the patients as only one product is ever being made at any one time. The isolator maintains a Grade A working environment inside the cabinet. Another type of cabinet that you may come across within an aseptic suite is a laminar flow cabinet or LFC. This is like a positive pressure isolator with an open front. It requires a higher standard of room with a minimum grade B working environment and full body coveralls including face mask and goggles, but it is generally easier to work in as it has an open front with less obstruction and more usable space. All items of equipment and ingredients must undergo disinfection between the support room and the clean room. This is a 4-stage process which starts with the sporicidal stage. In this unit we use hypochlorous acid wipes for this stage, which involves wiping the outer surfaces of each item. Any items that are joined together should be separated prior to this point to allow thorough cleaning and to ensure that perforation debris cannot accumulate. Once this wipe is complete, the items are left in a tray for 2 minutes to allow the hypochlorous acid time to work. Stage 2 requires the contents of the tray to be disinfected using 70% ethanol in 30% water spray and transferred into a second tray. This will attain a kill rate of around 96% and is the highest effective concentration of alcohol. It works by denaturing proteins and requires the water to allow the alcohol to enter the bacterial cell. After 2 minutes, the second wipe occurs with a low linting alcohol impregnated wipe. This removes any particles such as spore husks and physical contaminants like paper particles and increases the bacterial kill rate to around 98%. After this stage, the tray and its contents are transferred into the clean room transfer hatch and left for 2 minutes to allow the disinfectant time to work. The final stage of the disinfection process is a second alcohol spray using 70% ethanol, after which the contents of the tray are passed into the isolator and the doors are closed. This then locks the isolator for 2 minutes before the product can be made.